Hi everyone, Dr. Peterson here with Regions EMS for today's daily COVID update. Today is Wednesday, April 8th, 2020. Almost said August there for a second. Information presented today is current as of today. No guarantees it'll be current tomorrow. So you need to follow our website, regionsems.com. Click on the COVID link. You'll get up-to-date resources, a summary of our current recommendations, frequently asked questions, and lots of other things. So let's go to some statistics for today. Worldwide, just under 1.5 million confirmed cases. I emphasize confirmed because many people have not been tested, so that number should be quite a bit higher than that. And we've seen just over 85,000 confirmed deaths related to COVID-19. In the United States, just under 400,000 confirmed cases, 12,754 confirmed deaths. In Minnesota, we are just over 1,100 confirmed cases with 39 deaths attributed to COVID-19. More community spread happening right now, and what's nice though is we are seeing a linear growth rather than an exponential growth. So social distancing is working. Keep it up. Wisconsin, a little bit more activity, 2,578 positive test results, 92 deaths attributed to COVID-19. And again, the growth curve is linear rather than exponential. So we're doing something right here in the upper Midwest. And even New York now, I hear, is starting to maybe be over the hump. They're starting to see their peak flatten and slow down a little bit. Let's talk about a couple things that I want to emphasize today. First of all, the ECMO team is open for business. They want you to know that if you have a patient with a shockable initial rhythm, get moving quickly, minimize your scene time. Call the number at the bottom of the screen here to contact LifeLink Dispatch, who will patch you into the ECMO team so you can discuss the case with the ECMO doc. They want to hear from you. They will not be responding to other hospitals right now because of the pandemic, but you will be directed to the University of Minnesota where they can provide the same care. Don't forget that for those patients that might be eligible. And again, scene time is one of the most critical components to getting these people to the right place at the right time. Little concerned about some of our doffing practice in the ambulance bay. That's a high-risk time when it's easy to cross-contaminate as you grab the outside of a mask, the outside of your gown, whatever you might be wearing. This would be a good time to review your agency's policy on doffing. We have some CDC guidance on our website, and there's plenty of YouTube videos out there. Ideally, it can be done with 2 people to minimize the contamination, but it can be done with 1 person. Just have to be careful and make sure you're doing it correctly. A lot of the spread that we're seeing in healthcare workers and first responders is from provider to provider rather than from patient to provider, just because we're getting a little bit lax with some of our PPE use and our social distancing at work. So along the same lines then, social distancing at work, it's going to be lonely for a couple weeks. We are recommending as medical directors that you wear a mask anytime you're not eating and anytime you're outside of a private room. We need to minimize the time that we're gathering together in close proximity. We just got to do it. We got to stop the spread. You don't want to bring this stuff home with you. There are people out there who are asymptomatic that are infecting others, and this is the best way that we can control that, at least for now. So don't lose your vigilance to the infection prevention measures. Lots of hand washing, mask wearing, and just some common sense as well. And finally for today, there's been some information out about some blood tests that you can buy that will check for antibodies against the COVID-19 virus. I would caution you before you spend too much money just to consider this, that these are tests being produced by companies who are selling them for profit. They are not in use by the Department of Health or the large healthcare system labs because these tests have not been validated yet. They may be good tests, we don't know. But until they are, we just can't rely on the results. There's a number of strains of the coronavirus. How accurate are these tests against all of the strains? Are they targeted more towards specific ones that they were developed for? We just don't know. So there's work that needs to be done yet before these tests become widespread. The other thing is, what does a positive test result mean? Does that mean that you've had the virus and therefore are immune to the virus? We don't know. It's going to take a few years before we understand that more fully. Think about seasonal influenza. Just because you get it doesn't mean you're not going to get it again next year. There is some temporary immunity, but not long-term. So if you get a positive antibody test, that doesn't necessarily mean that you are more protected than anyone else from getting coronavirus. Again, with multiple strains, we just don't know enough yet to make that statement. So just a little bit of caution before you go out and spend some money on those. All right, back to Monday's trivia question. What is the correct plural form of the word virus? We had several replies from Chief Deputy Mueller, Washington County Sheriff, Chief Glazier from Stillwater Fire, Dave from Lakeview EMS, and Linda from Northland. All were correct. That the correct plural form of the word virus is actually viruses. Virus is a Latin word, and most Latin nouns that end in us are converted to I to make them plural, like fungus to fungi, cactus to cacti. Virus is unique in that it is one of the few Latin nouns that does not have a plural form. So therefore, we apply the English grammar rules, and it becomes viruses. You're welcome. That's your lesson for the day. For Friday, question will be, in what decade were the coronaviruses discovered? Send your best guess to regionsems@healthpartners.com, along with any comments, concerns, questions, cookies, whatever else you can send through the internet. Much appreciated. Other than that, stay safe, enjoy the sun, stay healthy, and we'll talk to you on Friday.